In this lecture, you will learn about the pharmacotherapy of type 2 diabetes mellitus. So basically, in the type 2 diabetic patients, they shall measure their fasting and postprandial blood glucose level every day at home, and then when they are coming to the physician, they should show the results on the follow-up day. Also, the A1C level shall be measured every 3 months because this one will give us an estimate of the blood glucose level over the past 3 months. So basically, if the patient is diagnosed with type 2 diabetes mellitus, they should be started on metformin therapy. If the patient has contraindication to a metformin, an alternative that can be used are like thiazolidine or the glitazones. If the patient's diabetes mellitus progresses while he or she is still on metformin therapy and the glycemic goal is not reached, an insulin secretory glucose like sulfonylurea or a glitazone or GLP-1 agonist can be added. But if the A1C level is greater than 1 to 1.5% above the goal, multiple oral agents or insulin therapy is appropriate. The options for multiple oral agents are metformin plus thiazolidine plus GLP-1 agonist, which is anti-intravenous. Another alternative are triple therapy contains metformin, sulfonylurea plus either GLP-1 agonist or thiazolidine. If the patient's A1C level is greater than 8.5% to 9%, insulin therapy shall be considered. Sulfonylurea are often stopped when we are starting insulin. And eventually all type 2 diabetes patients, they become insulinopenic and they will need insulin. So to introduce insulin, as we said, sulfonylurea shall be stopped, and we can introduce it by adding bedtime insulin, like intermediate acting insulin, while the patient is still on the daily metformin, like the insulin sensitizer. We are adding insulin sensitizer because type 2 diabetes patients are often resistant to the insulin. If this regimen still fails, we can start like the multiple daily injection of the insulin, like the basal bolus concept, while we are still adding the insulin sensitizer, like the metformin. That's for this lecture.